Ready to shine inside out? Welcome to Polished Beauty Podcast, where ambition meets empowerment. We talk business, beauty, brain, body. I am your host, Dr. Daisy Ayim, triple board certified cosmetic surgeon and OBGYN. Let's get polished. You've heard these words: peptides, exosome, regenerative medicine, integrative aesthetics. These are buzzwords that are exciting right now in the health and beauty industry, and there's some science to back this up, actually. In this episode, we're going to talk about all of it and why it matters. Well, it matters because it's essential in anti-aging or pro-aging, as we are discussing now in this future. It's important in skin healing, wound healing, and also other uses. Let's talk about peptides. What is a peptide? First, I want you to think of peptide as small chopped blocks of amino acids. And what is amino acids? Well, these are your building blocks to protein. So protein is the umbrella, and then you chop it into small amino acids, and that's broken down to even smaller peptides. Peptides, think of it as a messenger that basically tell your cells what to do. So depending on the type of peptide, it's going to have a different signal and a different message in your cells. So let's talk about the different peptides, because this is what is exciting. You're hearing peptides, and you're just like, what is it? Well, remember, as I mentioned, is the smallest part after the protein has been chopped down three ways. Okay. Peptides, there's a signal peptide. This is a peptide that will go to tell your body to produce collagen. So that's your signal peptides. The other peptides are your carrier peptides. These basically just take information from one cell to another. A good example of carrier peptide would be a peptide that carries copper. And copper is a mineral that is delivered in certain cells and is signaled to do certain things. So that's your carrier peptides. Then you have your neurotransmitter peptides. These are inhibiting peptides. So they go to a cell and they behave like Botox, basically stop whatever action that cell needs to do. All right. So there are different types of peptides. When you hear about peptides in your skincare products, be very mindful what type of peptide is it. Is it a signal? Is it a carrier? Or is it a neurotransmitter peptide? Okay. There are some clinical benefits to peptides that we know. The first thing is skin tightening. Is very important with that. As I mentioned, if you have a carrier peptide that carries collagen, it helps with skin tightening. Then you have your wrinkle reduction benefit, improves your skin barrier. And this is important for like healing processes if you've had some destruction, like say with radiofrequency microneedling. Then your peptides are really good for hair restoration. So if you've had some hair loss, peptides can be very helpful in that process. And if you've had any procedure done, you can use peptides as part of your post-procedure kit. Okay? There's some research, as I mentioned, to support and back this up. There's a study that was published in 2002 in the Journal of Cosmetic Dermatology that basically showed that copper tripeptides improve skin elasticity and density within 12 weeks. All right. And then another study that was published also showed that Matrix 3000, which is a type of peptide, has been clinically proven to reduce wrinkle death up to 33%. So peptides have some science behind it, and there's some clinical data to support this usage. All right, so how are peptides delivered to you? How do you get peptides in? Well, it's in the form of your serums, injectables, patches, and even microneedling transports. All right, so that's how you get peptides back into your system. Now, let's talk about another buzzword. So exosomes is everywhere. You would think that this is like a new thing, and it really isn't, as you get to understand when I talk more about it. Exosomes are extracellular vehicles that are secreted by your stem cells and take a message somewhere. So think of them as carrier proteins. They carry your proteins, they carry your RNA, they carry your lipids, and the vesicles that basically come in little packages that take from cell to cell. And that's what exosomes are. Packages that carry information, whether it's protein, lipids, RNA, and deliver it to another cell. And that mode of delivery is what is called your exosomes. So what do exosomes do? Well, they reduce inflammation, number one. They help with wound healing. It also helps with stimulating your body to produce collagen and elastin, and it promotes angiogenesis, basically creates new blood vessels for forming. That's what your exosomes are known for, and that's what it does to you. Where do we get exosomes from? Remember, I said it's not quite as new as it seems right now because it's being talked about so much. Well, you get your exosome, the most common is your mesenchymal stem cells, or we call it MSC derived exosome. This one is the most researched. We have some data on this that is huge. So that's where most of your exosome comes from. But you can also get exosomes from umbilical cord tissue, your placenta tissue, and bone marrow. I'm going to pause here because you guys know I'm a board certified obstetrician and I've delivered over 3,500 babies. I would say it was very interesting that I had some patients that wanted to take home the placenta. And because they were either wanting to keep it for their personal use or they were concerned that it was going to be used against their wish, which is not the case. You know, if once you've delivered, the placenta is collected, there's a proper way to discard it because it's considered human waste, right? And usually it goes to pathology and then that size discarded. But some patients wanted to take the placenta home. I've heard some stories like they eat it and all those things. I'm not even sure why I'm mentioning that at this moment, but it just took me back to my OB days when I used to deliver and I had this exciting parents wanting the placenta to take home. And of course, we gave it to them because it belongs to her. Anywho, that's where exosome can come from. The placenta tissue, your umbilical cord, but the most common place is those mesenchymal derived exosomes. What is the benefit of exosome? Well, it's helpful in skin rejuvenation, such as post-microneedling, laser procedure in your face. It's also helpful in the hair growth therapy, so you can use it to stimulate hair growth. It's also helpful for off-label use in orthopedics and neuro and wound healing. So your exosome has a diverse usage. What are some scientific data to support this? Well, there was a study published in 2020 in the Stem Cells Translational Medicine, which reviewed and confirmed that mesenchymal-derived exosome, which is your MSC, reduces scar formation and improves dermal remodeling. So that's some research that was published to support it. We also have a study that was published in 2021 by Nature's Review Molecular Cell Biology that stated and highlighted that there are some potential anti-aging and neuroregenerative benefits of using exosomes. Now, with all those fancy terms that I've mentioned and benefits of exosome, it's important to keep this in mind. It is not FDA approved yet. It's still considered investigative in the US. Don't say I need to have an FDA approved exosome because there's no such things. However, most clinicians and providers and doctors or whoever use exosomes, they obtain it from a lab derived outsourced place that is actually within quality, meets certain quality and standards. Now that we've talked about peptides, amino acids, and exosome, you understand all those terminology. Let's see where it all meets. Well, it meets in the regenerative medicine space. So when you hear the word regenerative medicine, I want you to think of a field that helps restore the body or replace tissues that are either damaged or trigger the body or organs to produce their own. So regenerative medicine is like a repairing medicine using exosome peptides to stimulate your body to do the work. Now, there are several technologies out there that we talk of when we speak of regenerative medicine. You've heard of platelet-rich plasma or platelet-rich fibrin. You've also heard of stem cells, and now we're going to add peptides, exosomes, and also biostimulator fillers into that whole pot of regenerative medicine. A biostimulator filler is an example of that is Sculptra. So essentially what that is a filler is injected into your skin and it stimulates your body to produce this collagen. And that is regenerative medicine. So you have all this different entity that make up regenerative medicine. That's very helpful. How would you use this? Well, regenerative medicine encompasses all those different things that I've just mentioned, can be used in the context of skin rejuvenation, which helps with scarring, volume loss, texture. It can also be used for hair restoration, whether you suffer from alopecia or any other hair disorder, that can be beneficial. Also in the vulvovaginal space. So for women that have vaginal atrophy, whether it's due to postmenopause, menopause, perimenopause, or postpartum, or any other vulvovaginal issues, you can use this regenerative techniques in that space. And also don't forget orthopedics. So orthopedic regeneration encompasses all those things I talked about. And that mainly focuses on your joints and your cartilage. So now we've talked about regenerative medicine. Let's speak of integrative aesthetics. It's a very fancy word, but it's very appropriate. And integrative aesthetics basically means that you're taking regenerative medicine and you're doing something in the aesthetic world. So for example, you can take your PRP, combine it with radiofrequency microneedling together, and you can add some peptides, some exosome, and that is integrative aesthetics. And that's all that means. So you've heard those words and don't think that it's anything other than what it is. Integrative just means you're pulling all these different resources, you're going to apply it and create amazing results for the patient. And this can be used in the context of post-procedure. I'm going back to my OB days. Post-procedure, and the whole idea is to have longevity, sustainability of your results. And also it can be used as a pre-rejuvenation, meaning you set up your skin before you actually do the procedure to get a better result. Now, there are some ethical things when it comes to all this biologics. You want to make sure that at least you would not know it as a customer, but at least go to a place that is outsourced from a reputable lab company. As I mentioned, these are not FDA approved therapies, so don't look for that because you're not going to get it. However, seeking a provider or physician or esthetician or a clinic that has those standards in place is very important for your safety and well-being. Regenerative medicine is no longer futuristic. It is here, it is happening, and we are getting some tremendous outcomes with it. In my practice, I incorporated into hair restoration a lot, the skin rejuvenation as well, and then the vulvovaginal space. So it is no longer in the future. It is here. It's right now. When you are seeking therapy, think of these things as well, as they can help boost your results. Peptides, exosomes are very powerful, but must be used responsibly. Okay? Very wary of unregulated products and clinics. How would you know? Well, ask questions. Do your research before you decide on a clinic and the product that is going to be used on you. You want to come in as an informed consumer because we're dealing with a space that's not FDA regulated, so you don't have that comfort reassurance like this is an FDA approved product. I'm getting exactly what it says it's going to give. I want you guys to stay curious, stay polished, and remember, true beauty starts at the cellular level and then it manifests outwardly. So I have a call of action for you guys. If you have any questions about exosomes, peptides, regenerative medicine, integrative aesthetics, I want you to comment below and I will answer it, or feel free to call my office or DM and you will get that one-on-one response, okay? This is exciting. And if you've not heard any of those words, you're probably living under a rock. And I know you're not, so you've heard of them. Now, just ask the questions because you understand the terminology behind those words. You know what it means and you know what the intent is. And as always, let's get polished. I hope you enjoyed this episode and thank you for listening. Video recording of this episode will be featured on our YouTube channel, Dr. Daisy Ayim. We are also found on Instagram at Polish Beauty Podcast or at Dr. Daisy Ayim. Remember, new episode drop every Wednesday, so stay tuned. Please like, share, follow.